My name is Anil Lalwani. I am professor and vice chair for research in otolaryngology, head and neck surgery at Columbia University Medical Center in New York City. Untreated hearing loss has consequences both structural in terms of loss of brain volume in those areas dealing with hearing, as well as cognitive decline. So it really becomes critical for us to evaluate patients and intervene earlier than later to make sure that those dire or negative consequences don't occur. Untreated hearing loss has consequences, but treatment has many positive consequences, such as improved quality of life, employability, enjoyment from daily activities, better social interactions, and we're really hoping also reduce cognitive decline as you reduce the sensory deprivation that comes with hearing loss. There are many predictors for outcome after cochlear implantation. I think one of the most important predictors is how long a patient's been deaf. We know that the longer a patient's been deaf, that the less well they might do with a cochlear implant. What we shouldn't forget is that maybe they've been deaf for 20 years and they may not do as well as somebody who's been deaf for only 10 years. But they're going to do still better than they would without having a cochlear implant. So while there may be statistically significant differences between performance, its impact on their life is still very significant. What is really quite apparent now with the body of work that's been published on intervention for hearing loss is that earlier is better. I think patients are often reluctant to move forward with cochlear implants because they're worried about losing whatever hearing they might have. I think the focus should be on how much function are they getting from their residual hearing. Because if they're not able to communicate, if they're not able to converse, and we know that the outcome with the cochlear implant will be better, the decision is really that your functionality will ultimately be better with the cochlear implant than not doing something. So it isn't about whether you can save the hearing or not so much. It's just that we know you're going to live better and function better with a cochlear implant. I think in our society we underappreciate the impact of hearing impairment on our lives. Whether it is in our ability to communicate, that's the most straightforward one, but not being able to socialize leads to depression, it leads to cognitive decline, and I have to think that as we rehabilitate hearing, both with hearing aids and more importantly cochlear implants, that there's going to be positive impact on their quality of life, in terms of their social function, in terms of their overall approach to how they take on new challenges and opportunities. That person becomes whole again, not defined by their hearing impairment.